Hello, runners. Good afternoon. I'm Coach Roberto Mandje, and we're going to be doing today is our HSS speaker series. And today, for this section, we're going to cover dynamic warm-ups. So it's super important. A lot of people have questions about warm-ups. What is it? How to do it? Should I even do it? Obviously the proper way. So I can tell you how I do it, but we're going to actually leave it to the true professionals. Joining us today is our friend Michelle from the Hospital for Special Surgery. Michelle, welcome. How are you doing today?
Hi, thanks for having me today.
Yeah, thanks for being here. So, as I said, we're going to be covering dynamic warm up. I'm an experienced runner, but you are the true professional in this field. So, we're going to, ask you several questions, follow ups, and then for you, the viewers at home, feel free to shout us out per usual. Let us know where you're watching from, but really do send us your specific questions on pre-race stretching, warm-ups, and anything else. We're not going to try to stump Michelle, but this is an opportunity to pick the brain of a true professional. So you're up for it, Michelle?
Yep, I'm ready.
Excellent. So I'll kick it off and give the audience a chance to populate some of their questions, shout outs. So right off the bat, I'll start with the first one. So when we do core strategy, we always say avoid the race before the race, and that's obviously try not to rush and leave yourself enough time to get to Fort Wadsworth, the athletes' village. But once you're there, once you're through the logistics, what can a runner do to stay warm? To pass the time, because a lot of runners are going to get there with ample time. They're going to be a little bit nervous, that nervous energy. So, if you could kind of maybe tell us a few examples of ways to dynamically warm up before the race.
Sure. I think the first thing that's incredibly important, which most runners may have already heard from either uh, people who've run the marathon before or if they've done one themselves, is to make sure that you first just arrive at the corrals with layers on. That way you can stay warm while you're in the corral. And then as you begin to warm up, you can start to shed those layers. And a lot of times those clothes will be donated um, to charities that need extra clothing. So that's number one. Number two is just try to stay as active as possible in the corral. You'll see a lot of times people sit down because you're there for so long before the race, but I would try to get up, every, I would say 15 minutes or so and get up and start to move around. And then when it gets closer to race time is when you'll start more of your actual dynamic warm up, which we'll talk more specifically about in a little bit. But I think the most important thing is just stay moving. What you don't want to happen is to sit and then all of a sudden your toes start to get cold, your hands start to get cold. And then by the time you get up and you're ready to actually start your warm up, everything's kind of numb. Definitely feel free to use hand warmers, either in your gloves or even in your shoes, just while you're waiting. And then obviously you would take them out when you're ready to start warming up. But goal number one is just keep your body temperature warm while you're waiting before you start your actual dynamic warm up.
Excellent. Yeah, it's a good point because, a lot of us are going to be arriving to the athletes' village long before the sun rises. And as a quick heads up, it's daylight savings time. So when you go to bed on Saturday night, you're going to get an extra hour of sleep. So it will be even darker, a little chilly. So definitely heed Michelle's advice on staying warm. But again, once you're there, dynamic warm up. Some people are going to be nervous, and you just said try not to sit down for too long, but some people want to conserve energy. Some people want to warm up, and sometimes you see in the village people doing complete opposites. People are seemingly to warm up super exaggerately for way too long, burning energy, and some people just want to sit down there and maybe meditate. So if you could maybe, Michelle, give us an example of some dynamic warm-ups, and maybe for the people at home, kind of define what a dynamic warm-up is, and then some examples.
Sure. So dynamic versus static. Static stretching and static movements are more of just kind of like your seated stretching. Maybe you're sitting touching your toes or standing touching your toes or standing stretching your quad. Those are all considered static stretches. And those are preferred to not do before an activity. We would rather you do that after. The goal of a dynamic warm up is to get your heart rate up and to get blood flowing to your muscles. That way, when you start to move, you're not moving on cold tissue. So it's the same way when it's winter out now, we go out and start the car 5 to 10 minutes before we get in and drive. That way, we're not driving on a cold engine. The same concept applies to our bodies. So, examples of a dynamic warm up, first, it's just getting your heart rate up. So, that could be something as simple as jumping jacks, just to get your base heart rate up before you're ready to do something a little bit more dynamic, such as like butt kickers or high knees. Now, you make a very good point as to how much you should be doing because you don't want to overexert yourself before you're about to start running 26 miles. Um, so I would say, that depends on the runner and kind of what you're used to, but you should feel like by the time you're done with your dynamic warm up, that your body is warm and loose, and you should feel like your heart rate is up and ready to run. If you're still feeling kind of sluggish and stiff, that means you probably haven't done quite enough. If you're starting to actually get a little fatigued, that means you're probably doing too much. But I would definitely start with something very simple. You can do jumping jacks. You may even just do some body weight squats while you're, initiating the process before you start to go into things that require more range of motion. Typical things that you'll see people doing: high knees are great. Butt kickers are also very simple and easy. You may do something like karaoke just to get a little rotation going through your hips and your pelvis to get you ready for your run. And don't forget about your upper body too. When we run, you're pumping your arms for 26 miles. So make sure you're doing maybe some arm circles around, just getting your whole body moving back and forth.
Wonderful advice. And I guess as a follow up to that, because I'm thinking to even my race I'll be running on Sunday is, you get there to the athletes village well beforehand, and the examples you just mentioned are great. But around what time before the race should a runner start? Whether you're starting at noon or 9:10. Obviously, those two runners would not be starting their warm up at the same time because somebody might have way too much time before the race and they're already too warmed up, and then somebody might want to leave it too late. So, what's an optimal window? You would say, Michelle?
Yeah, I would say ideally, I would want someone to be warmed up within like 10 to 15 minutes of the start of the race. That way, everything is kind of like up, ready to run. And by that point, you're starting to move through the corral. So it's not like you're standing static anymore. The tricky part is if you're in your corral incredibly early, you may actually want to consider doing just a few bouts of like very light dynamic warm-ups even earlier, just to keep your body warm and moving. So maybe if you're there, let's say somebody got there very early and it's a couple hours before the race, definitely keep your body moving. So maybe you do a little skipping back and forth for a couple minutes, and then you sit down for a little while and let time pass. So I would say the last warm up, 10 15 minutes before you're ready to go, but keep yourself moving. So if you're moving through the corrals, that's great. If your corral is slow to start, maybe you want to wait until like 10 minutes before. So you kind of have to feel out the environment and see if your corral is starting to move or if you're still in a stationary position. But if you're there very early, you may want to consider doing like almost 2 warm-ups to make sure that you're not getting stiff in between.
That's wonderful advice. Thank you, Michelle. And I'll be thinking you when I'm doing my own warm up on Sunday. But before that, we have some shout outs and a couple questions. So the first one, I'm not sure if you can see it, Michelle, but Edgar is saying, enjoy your marathon weekend. Thank you, Edgar. MK4100, smiley face emoji. We have viewers from YouTube world and Facebook, so that's why you get some of those names. Stacy, she's en route to New York City from the Finger Lakes, so you're probably coming from a colder region. We welcome you down here in the next day or two. Okay, now for some questions. I'll read it out and you can answer it, Michelle. So Matthew, any advice when it comes to IT band pain?
So the IT band is one that's going to get a lot of runners. The tricky part about patients who have IT band discomfort is that the cause of it can be a variety of things. So unfortunately, there's not like one solution for everything, but I would say definitely make sure that you've done a really nice warm up because the IT band attaches to the outer edge of your quadricep muscle, which you're going to be using a lot during the marathon. A lot of people think that you can foam roll your IT band, which is actually not true. It's a very thick fascial tissue that is not extensible, so you can't stretch it or roll it, but you can work on the soft tissue surrounding it. So for that type of a runner who's having an issue, I would make sure that you do a really good warm up of your quadricep muscles. Foam rolling over that area or stretching of your quadricep would be good. And then potentially you may want to be doing some hip related strengthening just to kind of wake up your glutes to give a little bit more dynamic stability to your hips and knees as you're running on race day.
Excellent. And actually, I have my own question to interject now. You just mentioned a very interesting tidbit that I think maybe a lot of runners might have glossed over, but you said a lot of runners think that you could foam roll your IT band, but that's incorrect. So obviously they do get down and put their body weight on, and they are foam rolling over their quads. So when they're doing that, how off base are they? Are they kind of helping it a little bit? Because some runners do feel better. Is that like psychosomatic, or should they be doing something completely different going forward?
Yeah, I mean, a lot of times people, if you're foam rolling, what people would say like is the IT band. If you're rotating a little bit forward towards like the front of your quad, you'll actually get on that border between the two tissues, which is fine to work on. For the people who are just rolling straight on the side of your leg, yeah, you're not really accomplishing too much. Are you going to hurt anything? Probably not. If somebody reports that it feels better after, that's okay. Whether it's placebo or they're just getting a little bit of like neurologic input to their nervous system, and it feels better, that's fine too. Structurally, there won't be any change to the IT band, so it's probably going to be a short-term relief if they feel anything. But they're probably not going to hurt themselves doing that. It's probably just not the best bang for their buck.
Thank you for that. I don't want to say you blew my mind, but that is definitely very helpful advice. We'll be sure to pass that on to our runners. Another question from Chris. What do you recommend runners with a noon start do to make the time pass and stay ready?
That's an interesting question because it is a late start for some people. So definitely make sure you're paying attention to what you might need leading up to the race. So if you have a noon start, you want to think about a couple things. So nutrition and hydration is one. So you want to make sure that if you're there really early and that you're going to have a lot of time that you have what you need. But I would say as far as passing the time is if you're with a friend, that's great. If not, it's a great place to meet new people and ask how their training is going, where they're from, things like that. But I would just try to, as we talked about before, just try to stay as mobile as you can in the corrals because it sometimes can be quite a long time that you're in there. And you definitely want to make sure that you're not, getting cold, especially on Sunday. It's going to be a little chilly, not bad, but you want to make sure that you're not getting stiff while you're there for so long. Hopefully by noon, the temperatures will have risen a little bit. So you'll actually be a little bit warmer. But again, I would stay in layered clothing and don't take it off until you feel like you're ready. And just try to stay as mobile as possible.
Yeah, thank you for that, and good luck to Chris. Nicole asks, any advice for getting still tired legs ready for race day? In parentheses, I ran Boston and feel like I'm still recovering.
I would say at this point, you're 2 days out, so there's probably not a ton. But I would definitely recommend either, trying to keep your legs loose with shakeout runs or cycling or some type of active recovery. If you have access to like a Normatec for compression and elevation, that would be a good thing to do. But I would just try to keep your legs moving on like a bike would probably be ideal for you to keep blood flowing, but without putting extra stress on your legs to try to recover as much as possible before you have to run on Sunday.
Yeah, and actually, I'm not Nicole, but thank you for answering that question, Michelle. Because the other question I guess I have to piggyback on that is, if you have access to a bathtub, would you recommend somebody doing an Epsom salt bath, Michelle, in order to kind of help loosen up their legs or maybe recover from somebody who's just done Boston?
Yeah, I mean, that would be something fantastic. You could definitely use that. Soaking, warm showers, using that. And then maybe afterwards doing a little bit of soft tissue work, once the tissue is kind of warm and loose. But yes, doing Epsom salt baths or just soaking would be, a good thing to try to do to keep your legs loose and ready for Sunday.
Excellent. Thank you for that. So again, keep submitting your questions. Michelle is a pro, and I'm learning so much already that I'm asking my own questions. So we definitely want to hear from you. But kind of going back to some of the questions I had for you, Michelle. So unfortunately, a lot of our runners, somewhat myself included, we get to the start line not feeling 100%, little niggles here and there, or not a full-blown injury. But for those runners who are getting to the start line on Sunday, and they've been getting, a mild injury, but has been actively treated. What sort of warm up could they do?
Sure. I think it really depends on what the injury is that the runner is dealing with. But I would say if you've been actively treating your injury and you're leading up to Sunday, you would definitely want to have a conversation with whoever is working with you on that treatment to see if there are specific things that they want you to do. So just for example, if I have a runner that I'm treating in the clinic and we've talked about certain things that I want them to do prior to like a training run, for example. So I may have a patient who I have them do some glute work or some activation of their hips before they run. I may tell them, bring a little rubber band with you to the start of the race. You're going to do these 3 exercises, X, Y, and Z, and then you can throw the rubber band in the trash while you're there. That way you've gotten your, prescribed exercises in that I want you to do, but it really depends on the injury. So I would recommend, if someone is dealing with something, to just send a quick email to their PT or trainer, whoever they're working with, to see if there's anything specific to that injury that they should be doing outside of just kind of like a general warm up.
Excellent. And I guess, unfortunately, staying on the somewhat injury theme, because it's a reality of life sometimes when people are training for a marathon, the next question is more about what runners should be doing as far as experimenting. We're getting a lot of great knowledge from you, especially on the foam rolling side, but should runners be experimenting with new treatment options this close to the race day?
I would say in the ideal world, it's not the best time to try something new. The exception to that would be if something popped up kind of this week that you're dealing with, and your goal is to just make it through, Sunday. You could definitely, try something to manage to make it through. But ideally, you don't want to try new things leading up to a race, especially a marathon distance, just because if you apply a treatment and you have an adverse effect to it, that could throw your whole race and cause you to have to pull out or stop. So I would say in the ideal situation, no. But if it's something very acute that you're trying to manage and just get through the day, you could potentially do that. But I would definitely recommend consulting with, either your PT trainer or MD, depending on what you're dealing with.
Yeah, and as a follow-up to that, because we've been getting this question a lot, it's been cause of a little bit of laughter behind the scenes over the last couple of days, but KT tape, it seems to be coming up a lot in questions from our runners in previous course strategies. So something that is relatively mainstream now, like KT tape, is that something that would fall in that category, or are runners able to use that if they haven't used it? And if so, how would you recommend they use it race week, and even maybe the race morning or during the race?
Yeah, I think KT tape, now it's become, like you said, very mainstream, and they even sell, pre-cut strips with instructions on how to put them on. I think the difficult part about that is, you need to know if the tape that's being applied and the way it's being applied is appropriate for the type of injury that you have. So sometimes that's hard to tell on your own as a runner without, input from a medical provider. However, using KT tape, even if you were to use it and not quite sure if it was like the appropriate application or not, it's probably not going to have an adverse effect on you. The pull of the tape is fairly light. So, using it, I would say, you might not get full benefit out of it, but it's probably not going to hurt you. So if somebody was struggling with a last minute injury and they, threw that on and tried it for, a shakeout run, maybe today or tomorrow, and they felt better with it, then I would say you could definitely apply that race day Sunday and see if that helps get you through the race. But don't forget, there are always stations along the course where you can stop if something goes wrong as well during the race.
Yeah, thank you for that. And additionally, and this might be outside of your field, but like we see oftentimes, whether it's at Walgreens or CVS, different colors. Some of them are flesh colors, so we just assume that that's made to blend in more with your skin tone. But then some of them are wild different colors: red, blacks, orange, whatever. So we've heard out there in the running world at times that there's different strengths to the KT tape. So can you speak about that? Because a runner might go for a color just because they like it, or thinking that this is more supportive.
Sure, of course. A lot of what they've done now is the adhesive strength on the back of the tape has changed a little bit, because for some people, especially as you sweat or just their skin type, it doesn't stick quite as well. So there are different types of strength on the tape. So you may be reading it and being a little bit confused as to what it says that. The only thing I would caution people on is if you have sensitive skin, I would stay away from the higher stick KT tapes or other branded tapes, whatever it is that you may be using, because you may give yourself a little bit of like a rash or a reaction from it. But in general, the colors sometimes actually, depending on the brand, translate to like how you put it on. Like they'll use short strips will all be one color and long strips will all be a different color. So don't focus too much on the colors. I would just read the box and make sure you're looking at how strong the stickiness is. It's really as you pull the tape apart, there's a certain amount of stretch you can put on it for what the goal is of doing it. And that's why I say, it's best applied by a medical provider. But if you have to apply it on your own, they do have a lot of YouTube videos now. And typically there's instructions on kind of the pre-cut ones that you can use. Most commonly are for the knees.
Wonderful. And the last question on that topic, at least from me, sometimes when you get the box or the roll, you see says you could leave it on for 24, 48 hours or whatever. If I'm a relatively new runner to using KT tape, today's Friday, tomorrow's Saturday, and then obviously race day Sunday, when would you recommend applying it, and how long would you recommend leaving it for? Because obviously, when the race finishes, you could peel it off right then or a day or so later. What would be your general window?
Sure. With any type of tape, when you apply it, it's going to start to lose its stretch pretty quickly. So I would definitely apply it race morning before the race. So realistically, it probably doesn't make sense to bring it to the corral because you're going to be busy doing other things logistically. So I would put it on before you leave the house. And then really you can take it off as soon as you finish the race. If you have sensitive skin, you may want to kind of get in the shower and let the warm water run over it and try to take it off there. There's no harm in leaving it on. It's going to start to peel off on its own. But really, once you're done running, that's kind of the point of having it on. So you can remove it at that point.
Excellent. Thank you for that. And as I mentioned, that's the last of the questions that I have on KT tape. But I'm saving the last question, at least that I have, which is, a tough one, but it's 26.2-mile race. Conditions are going to be ideal, but even then, sometimes life happens. So for runners out there who may be wondering, what would you do if an injury pops up for a runner during the race? What would you recommend?
Sure. I think an important thing to know for all the runners is that along the course, there are medical tents. I think sometimes people think if you go into a medical tent, that means you can't finish the race, and that's not true. So if you feel like an injury is starting to occur, you can definitely pop into one of the tents and speak with a medical provider. Typically, there's a doctor and there's usually physical therapists in the tents along the course as well. If it's something minor, they may be able to help you manage it, to get you through the race, whether that's with potential taping. They may do a little bit of assessment on you real quick to see if it's something serious. And then if it's not, you'll head back out. But just remember, having someone look at it and potentially getting a little bit of advice on the spot may actually help you finish the race, versus if you keep pushing through it and you don't stop because you're nervous about going into the tent, you may get to the point where you actually have to stop the race because it's gotten so much worse. So if you feel something happening and you see a medical tent coming up, feel free to go in and have someone look at it. The worst that they say is, we think that, you should stop running. And then at that point, it's your decision whether you stop running or not. But just remember, they may be able to actually help you with the acute management of whatever you're dealing with and to get you to the finish line. So don't, be afraid to go in those tents.
Yeah, thank you for that. That's sage advice, because I actually never even thought about that component, that a runner might actually think like, I don't want to go into the medical tent because that's an easy pass towards a DNF. But it is true. Thank you for sharing that yeah, just going to the medical tent does not mean that you're negating finishing the race. So for those of you runners out there, ideally we want to stay out of that, but they're going to be out there from miles 3 to 25 on Sunday. So if you need it, be sure to stop by. We're going to take a few more shout outs and a couple more questions. We got John saying hello and thanks for the great advice. That's definitely to you, Michelle. Danny, thank you. Again, to you, Michelle. And this is Beverly, our producer, John Phillips' mom. So Beverly Phillips, thank you, NYR. Thank you, Beverly. We love your son. I love trolling him. All right. Mana wants to know, can we do anything to support a mild groin strain / mild hernia?
That one's tough, Mana, without having, assessed it to give appropriate advice on that one. So I would definitely say if you've been dealing with that, you definitely want to consult with your medical provider. That's tough because you need to know exactly what's going on to be able to give specific advice for that.
Thank you. Melissa, Will there be someone at the expo providing medical taping for support of injuries, past injuries? I guess, yeah, I'll take this. Do we know? I don't think they'll be doing that. This year with the way that we're doing the expo, we're trying to limit touch points, so there will be different booths there. You could obviously purchase K-tape, foam rollers, things like that. And as Michelle said, on race day there'll be the medical tent at the Fort Wadsworth. HSS will be there as well. And then you mentioned earlier YouTube videos, but yeah, nothing this year at the expo of the sort. Okay, next question is from Yavor. What is your opinion of massage guns? Would you recommend using one on your IT band, or is it dangerous, ineffective? I've used mine for months, so I'm used to it.
I think massage guns have obviously grown in popularity. I don't think they're dangerous. I think, it's just a different way to work on soft tissue. Again, I would say the principles still apply of, you can't necessarily massage your IT band, but you can massage the areas around it. So the quad on the front and the hamstrings on the back. So I don't think they're bad. I think that, for me, I'm more of I have an active bias. So I would always rather a patient do some type of active mobility work as opposed to passive with, a gun. But the machine guns I wouldn't say that they're bad. I don't think they're dangerous. I think you just need to know how to use it and what's appropriate for you based on what you're dealing with. So if you purchase one, or maybe for the holidays, you're going to purchase one, and you're currently receiving treatment, just let your therapist or trainer know, and they can walk you through things that would be good for you to specifically do, or they'll tell you things that they prefer you not to do based on what you're dealing with. So just make sure that you're getting advice from someone specific to you, and you're not just reading things online that you should do, because it might not be the best thing depending on what your personal injury or situation is physically.
Great. John, oh, here we go. I kind of asked this question earlier, but Epsom salt bath versus ice bath. What should I use and when? Pre, post race?
So I would say you can go two ways with this. If I have a runner who said, I've always done ice, and I feel better with it, then I would say do that, and vice versa. If you've never done either, I would say, Epsom salt, before may be a nice way to relax, and afterwards, I would actually say either would be fine. Most people are going to probably think that they should go to the cold, but really by the time you get home from the race and settle down, I think either would be appropriate to do. So if you have a preference towards one versus the other, I would do that.
I love that answer because I personally hate ice bath. I get so cold, obviously, so I always opt for Epsom salt baths, and I always do them after. But good point about, yeah, by the time most of us get home post marathon, it's been so long that either is going to work. So thank you. Okay, we have another question. Ben, I rolled my ankle the other day when I stood on my dog's toy. Bad dog. My foot is still swollen. Any tips to get the swelling to go down before Sunday?
Yeah, I would say, the best thing you could do is compress and elevate. And by elevate, I mean it needs to be above the level of your heart. So a lot of times what people do is they'll be sitting at their desk like I am, and they'll put their foot up on like a stool because they think that's elevated. But if your foot is not above the level of your heart, you're not getting true elevation. So you need to make sure you have that gradient to bring the fluid down towards the larger vessels, to get the fluid out. So I would say, compression wrap, whether that's an ace bandage or getting like a slip-on compression sleeve at a convenience store today. Another thing you can do is just ankle pumps to try to keep your calf pumping. That will help you actively get the fluid out as well. So just pumping back and forth. But really, those couple things are the best thing you can do over the next day or so to see if you can get that swelling down.
Excellent. Well, thank you for that, Michelle. You managed to pack a lot of useful information in a nice, tight window. I know I learned a few things that I look forward to sharing with our runners. So, again, thank you for joining us today, Michelle. Thank you to the runners out there. And I guess if you have any other questions between now, race day, or even along your running journey, you could visit Hospital for Special Surgery at their Upper East Side location here in Manhattan, or on their website. They go by HSS or Hospital for Special Surgery. So thank you very much, Michelle, for joining us today.
Yeah, thank you so much for having me. Good luck to everybody running Sunday.
All right.